Have you ever gotten to the end of a long day, looked down, and noticed your ankles are kind of puffy? It's something that affects millions of people, but we often just brush it off. Well, today we're going to dive into what's actually going on. We're talking about chronic venous insufficiency, a really common circulation issue that, thanks to a recent news story, is finally getting some attention.
So, let's kick things off with a story that got everybody talking. It's not every day that a common medical condition becomes a headline, but it's a fantastic reminder that this is something that can affect absolutely anyone. And you might even recognize some of these signs in yourself.
Right, so this observation about former President Trump's swollen ankles was a huge public wake-up call. Now, doctors were quick to rule out anything more serious, like heart or kidney failure. Instead, the diagnosis pointed to something incredibly common, something so many of us deal with but might not even have a name for.
And that name is chronic venous insufficiency, or CVI for short. And get this, it is the #1 circulatory problem people face. Think of it like a plumbing issue in your legs. The pipes, your veins, are having a tough time getting blood to flow back uphill to your heart, so it starts to back up and pool.
So why does this happen? What's actually going on in there? To really understand the swelling, we've got to look at this incredible system our body has to fight a force that's working against us every single second of the day, gravity.
I mean, it's that simple. The core of this whole problem is a constant tug-of-war with gravity. Every moment you're sitting or standing, gravity is relentlessly pulling blood down into your feet and your ankles. So your body needs a clever way to push it all the way back up to your chest.
And this is how it does it. It's brilliant. Inside your veins, you have these tiny little one-way valves, about the size of a fingernail. In a healthy vein, they pop open to let blood flow up, and then they snap shut to stop it from falling back down. But with CVI, those little valves get weak or damaged. They don't close properly, and that allows blood to leak backward and pool up.
So what gives the blood that upward push to begin with? Well, this is where a really amazing part of our body comes into play, our calf muscle. It's often called our second heart for a reason. Every single time you walk or even just flex your foot, that big calf muscle squeezes the veins and literally pumps the blood up, fighting against gravity.
Okay, so now that we get the mechanics, let's talk about what puts us at risk. Because a lot of our daily habits, things that seem totally harmless, can actually be making it harder for our second heart to do its job.
Basically, anything that puts a lot of sustained downward pressure on your leg veins can start to weaken those little valves. We're talking about things we do every day, sitting at a desk for hours, being stuck in a car or on a plane, standing still for a long time. Other things like pregnancy, being overweight, or even habits like crossing your legs or straining, it all adds pressure that can overwhelm the system.
But here is the really good news. Because this is often a mechanical problem, a lot of the fixes are, well, they're mechanical too. This isn't just something you have to live with. You have a huge amount of power to help your circulation with some really simple, natural steps. This is your game plan.
The single most powerful thing you can do is just activate that second heart. If you're sitting, do some simple calf pumps. Just lift your heels up and down. You can tap your toes or do a little rocking motion with your feet. The goal is to just get that squeezing action going. And of course, the best medicine is to just get up and walk around for a couple of minutes every 45 minutes or so.
Now this is fascinating, the great sock debate. The right kind of socks can be a huge help. We're talking about graded compression socks. They're designed like an ice cream cone. They're tightest at the ankle and get looser as they go up your leg. This helps squeeze the blood in the right direction. But the wrong socks, like regular tube socks with a really tight band at the top, can act like a tourniquet, cutting off circulation and making the problem even worse.
And of course, what you eat and drink makes a big difference. Now here's a huge mistake people make. They think if they're swollen, they should drink less water. It's actually the exact opposite. You need more water to help your kidneys flush out all that extra fluid. It also helps to limit salt, which makes you hold on to water, and to eat things with flavonoids, like berries and citrus, which actually help strengthen your vein walls.
You know, your body is really great at giving you little hints when something isn't quite right. The trick is knowing what to look for, so you can catch the underlying problem before it gets more serious.
So yeah, swelling is the obvious one, but it's really just the tip of the iceberg. Other signs that there's too much pressure in those veins can be things like spider veins, or those bigger varicose veins. Maybe you get leg cramps at night, or your legs just feel heavy and achy all the time. You might even notice the skin near your ankles getting a brownish tint. These are all clues that the pressure is building up under the surface.
Okay, this part is really important. We have to distinguish CVI from a much more dangerous condition called deep vein thrombosis, or DVT. CVI is a problem in the superficial veins, the ones closer to your skin. It's a pain, but it's manageable. DVT, on the other hand, is a blood clot in the deep veins, and that can be a life-threatening medical emergency. Knowing the difference is absolutely crucial.
So if you think you might have CVI, what can you expect if you go to the doctor? Well, it usually starts with a simple visual exam. They'll just look for the signs. They might use something called thermography, which is a cool, non-invasive way to see heat from inflammation. But the gold standard, the definitive test, is a duplex ultrasound. It actually lets the doctor see the blood flow in your veins and can tell them for sure if it's going the wrong way.
So after all this, what's the big takeaway? What's the main message? It's really a message of empowerment. You don't have to just sit back and let gravity win. Simple, proactive habits can make a world of difference for your circulation.
So here it is, your proactive checklist. Super simple. Move your legs, drink your water, put your feet up when you can. Think about getting those special socks for long trips. And probably the most important thing, just listen to your body. These little things add up and help your body do its job so much better.
So I'll just leave you with this one final thought. You now understand the science behind your body's incredible second heart and the simple things that help keep it pumping strong. So the question is, what's one small change you can build into your day, starting right now, to help it win that daily battle against gravity?